So, hi everyone. Welcome to our April Sugar Club. For those of you joining us again, welcome back. And for those who are new, hello. We'll just be speaking for roughly an hour about things that are important and relevant to diabetes. So, we won't wait any longer and we'll get started. So, in this session for Sugar Hour, we'll be talking about sort of working as a team, and we'll also touch on some sick day medications, SGLT2 inhibitors, and Ozempic. And like I said, working together as a team, as well as what you should bring to your appointment.
So hello everyone, my name is Aditi. I'm going to start by talking about sick day medications. So being diabetic doesn't necessarily mean that you're going to get sick more often. However, having diabetes can exacerbate or escalate certain conditions, which can lead to potential serious illnesses. So some of the examples I've listed down below that you're more prone to when you're diabetic and you're ill are dehydration, hypoglycemia, diabetic ketoacidosis, and hyperosmolar hyperglycemic syndrome, or HHS. And I'm going to briefly go over the symptoms and signs so you know how to recognize these conditions and why they might occur. So starting off with dehydration, some of the key symptoms to look for are a headache, lightheadedness or dizziness, thirst, fatigue, dry or cool skin, irritability, confusion, or infrequent urination. And when you're a type 2 diabetic and become ill, you're at risk of becoming dehydrated. So if you're really ill, you're throwing up, you're not able to keep fluids down, that can make you dehydrated. A lot of your medications might work to flush fluids out of your body, can also make you dehydrated. And this places stress on your kidneys, which can lead to an acute decline in renal function. So next on to hypoglycemia. So taking medications that reduces your glucose levels can put you at a higher risk of hypoglycemia, which is low blood sugar when you're sick. So again, some key symptoms to look for are headache, lightheadedness and dizziness, shaking, sweating, anxiousness, hunger, elevated heart rate, difficulty seeing, irritability, or sleepiness. Moving on to diabetic ketoacidosis. So this is something that both type 1 and type 2 diabetics can get. And essentially you can detect ketones on a person's breath. So the breath will smell really sweet, like a pear drop smell almost, or in the urine or the blood. And this is a fairly serious condition. It does require urgent hospital admission. So some things to look for with this condition are excessive thirst, polyuria, dehydration, shortness of breath, abdominal pain, cramping in your legs, nausea, vomiting, mental confusion, and drowsiness.
So, Aditi, and ask Bo as well. You mentioned the ketones and things of that nature. So, Bo's our diabetic educator. Can you comment on, should we be measuring ketones? What type of ketones should we be looking for? And this part about the breaths and stuff like that. What's your thoughts about that?
So even though both type 1 and type 2 are prone to it, it is more type 1 diabetes, because the cause for type 1 diabetes is insufficient insulinization. So in other words, they can get really sick really quick, related to not having enough insulin. And so they're burning fat for energy. And that's what the ketones are. If we burn sugar for energy, it's very efficient fuel. So we have very little left over. But if we start burning fat for energy, it's not efficient. And ketone bodies are the waste products of fat metabolism. And so it can turn the body very acidic very quickly. So type 1 particularly, we're very, very on the alert for that. We do teach people about this. Even though Aditi said that most often you should be going to the hospital, if people have the right education and if they're taking insulin already at home to manage their diabetes, we can teach them about how to measure glucose, how to measure ketones, and how to respond by taking more insulin to try to clear those ketones out. The other point about all of this is to try to figure out what is the cause of it. So if a person's got another illness like a gallbladder attack or something like that, then for sure they would need to go to the hospital, because they need whatever the cause of the issue is to be treated. And then for type 2 diabetes, some of the medications that we're giving, that we're going to talk about later tonight, can actually sort of predispose our patients to this type of a situation. Oh, and the types of ketones, you can measure ketones in the urine or in the blood. but the best is measuring them in the blood because it's the most current information. The ketones that are in the urine, it takes a while for the blood to filter through the kidneys and then for the ketones to get into the urine. So the most up-to-date information is in the blood rather than the ketones that are in the urine.
So how does one go about measuring these things?
So there's a meter, it's the Precision Neo. If people are using the Libre meter, the reader for the Libre meter is the same technology, but all they would need is the strips to measure the ketones. And they would do a drop of blood and they would get a number. So it's normal for us off and on throughout the day, if we've gone a little bit longer without eating, we might burn a little bit of fat, people who have diabetes, people who don't. So a number less than 0.6 is usually okay. Once you get between 0.6 and 1.2, we start to see that there needs to be some type of intervention. And definitely once you're between 2 and 3, it's crisis. The other thing is, it's much like the blood sugar. If you're trying to fix the problem and you're addressing it by drinking lots of fluids and taking extra insulin, but the ketone levels are getting worse, then that indicates that you need to go to the hospital as well, because you're not able to manage that at home. Likely because there's some underlying infection or illness.
So we have to always distinguish between type 1 and versus type 2, because in type 1 you can't produce any insulin. You always need to have insulin to help protect yourself. In type 2 it's a little bit different. So if you want to say, Bo, when should someone go to the hospital, you think, with type 2 diabetes and type 1 diabetes? What are the things that really worry you the most?
So again, type 1 diabetes, if blood sugar is progressively going up, getting worse, and not improving, even though they've tried to take steps to address the issue and take more insulin, if ketone levels are going up and getting worse, if they're not able to keep anything down, because again, they need likely to take more insulin when they're sick, more than what they normally would take. So if they're vomiting and they're not able to keep anything down, it's not safe for them to take more insulin than they would normally take. So they need to go to the hospital because they need to be investigated for whatever the issue is, and definitely get on an intravenous where the hospital can balance out their fluids, so the dehydration issue, and give them insulin in the intravenous, but also give them glucose to balance things out. In terms of type 2 diabetes, again, if they're having symptoms much like some of these symptoms that we have in our list, and they're worsening, they're not getting better, then they should go to the hospital.
Thanks so much. Anything else you want to add there to that, Aditi?
No, I think that sums it up perfectly.
So I always think about, again, type 1 diabetes, you have no production of insulin, so you always require insulin. Type 2 diabetes, you are producing insulin, but you're also resistant to your insulin. So they're different diseases, and many of these processes with proper education can be managed. But if you're not sure, always seek help. Go ahead.
So finally, moving on to HHS. This is usually something you see after several days with the glucose consistently above 30 millimoles per liter, and it's potentially life-threatening. So again, it might require pretty urgent admission to the hospital. Some key symptoms to look for is disorientation or confusion, polyuria, thirst, dry mouth, nausea. And it's important to note that in later stages, the person becomes gradually drowsy and can lose consciousness. So if you recognize any of these signs or symptoms, it might be a matter of time before you approach that later stage. So just keep that in mind. You might need to seek medical attention quite quickly.
One thing to remember, if you're able to drink water is the most wonderful fluid in these circumstances for a type 2 diabetic. If your blood sugar is going up, you don't want to be drinking juice, you want to be drinking water.
So now onto the actual medications. So a great acronym to remember sick day medications is SADMANS. And I'll be going over what each of these medications does, why we might need to stop them, what are some of the types of medications. But if you're ever looking for more information, please visit the Diabetes Canada website. They have a lot of information about this and some excellent resources to help you understand it further. So starting off with sulfonylureas or other secretagogues. So basically, these work to increase the insulin that's released from the beta cells of your pancreas to help reduce blood sugar. So they should be stopped because there's reduced clearance of this drug by your kidneys when you're sick, which can increase the risk of hypoglycemia. So some of these examples include glycoside or diamicron, Amaryl, diabeta, or glucagon. Next up is ACE inhibitors. So this is a blood pressure medication. It slows the activity of angiotensin converting enzyme, which is this enzyme that helps produce something that's involved in regulating your blood pressure. So by stopping the activity of angiotensin converting enzyme, you'll reduce your blood pressure. So they should be stopped because blood pressure reduction might not be ideal or favored in an ill state. And you might be asked to stop this medication while you're sick by your physician, just so that your blood pressure isn't constantly dropping. So a way to recognize ACE inhibitors if you're taking them is to look for the medical name and see if it ends in pril. So some common examples are benzapril or lotensin, enalapril or Vasotec. There's perindopril or Coversil, quinapril, Acupril, ramipril, Altase, trandalapril, Mavic. These are some things that if you're taking an ACE inhibitor, you've probably seen this on your medication list. So just look out for the pril and you can recognize an ACE inhibitor. Next up is diet. Oh, sorry, go ahead.
One track is you can see that each medication has two names to it. It has the chemical name, which is called the generic name, and then it has the name brand. It's like saying ketchup or Heinz ketchup. So Heinz is a name brand, and ketchup is the active ingredient in there. So most of us, easier to remember things like ramipril versus Altase. So it's good to know both names if you can, and so just be attentive that every medication will have more than one name to it.
Next up is diuretics or direct renin inhibitors. So diuretics are water pills. They increase the water and the salt that's expelled in your urine to help reduce your blood pressure. Direct renin inhibitors work on the rate limiting step of the RAA pathway, which is kind of a way your kidneys regulate your blood pressure. And renin is basically involved in converting angiotensinogen into angiotensin 1, which kind of starts off this entire pathway. So a direct renin inhibitor is also going to help bring your blood pressure down. So why do they have to be stopped? It can cause a decline in kidney function if you're sick. However, an important thing to note is that if you are diagnosed with heart failure and you're taking a diuretic for heart failure, you have to contact your healthcare provider before you stop the diuretic, especially if you're on furosemide or Lasix for heart failure. Make sure that you're contacting your physician, the person who prescribes the medication, anyone managing your care, to make sure that it's okay to stop this medication rather than making that decision on your own. And
with these medications as well, diuretics or water pills, so you have to decide. So for sometimes you need to talk to your doctors, but you can also learn how to manage that yourself. If you're dehydrated, your legs are no longer swollen, your blood pressure is low, holding your water pill for a couple of days is not unreasonable. But so you keep weighing yourself, keep keeping track of that. So obviously, as you learn your diabetes, you can learn how to manage that disease better, but that's why you want to become part of the healthcare team, as we're doing here, versus just always trying to, so working together in some way. So absolutely.
Yeah, for sure. With all of these medications, the longer you deal with the condition, you might recognize different signs and symptoms and how to manage them. So again, for sure, making sure you're weighing yourself, looking at water retention, that can kind of inform whether or not you might need to stop a diuretic. And just some examples. So furosemide or Lasix, there's hydrochlorothiazide. An example of a direct renin inhibitor is Rasilis or Aliskiren.
One of the things when you go to the hospital, the first thing you measure is vital signs. So basically, you need to have your own blood pressure machine. So to me, in this day and age, not having your own blood pressure machine and trying to manage your health right now is probably not a great idea. So I suggest everybody, in fact, in Canada should have their own machine, especially if you have diabetes, especially taking medications that affect blood pressure.
So next up is metformin. This is probably a medication you've heard of. It works by helping to lower the amount of glucose your liver releases into the blood, and this helps make it easier for your body to use insulin. So it might need to be stopped because when you're sick, there's reduced kidney clearance of metformin, which can increase the risk for adverse effects. For example, having reduced clearance of metformin can cause your stomach to get really upset. So there's different formulations of metformin. There's just regular metformin or glucophage, or there's a long-acting version, which is called Glumetza. And next on to angiotensin receptor blockers. This is another type of blood pressure medication. Again, it's working on that RAA pathway I mentioned. So it blocks the action of angiotensin 2. Angiotensin 2 would normally cause vasoconstriction or constriction of your blood vessels, which is something that would increase your blood pressure. So by blocking the action of angiotensin 2, you are able to reduce your blood pressure. So again, this medication may need to be stopped due to increased risk of decline in kidney function when you're sick. And a way to recognize angiotensin receptor blockers or ARBs is that they end in like artan. So you can look for that in like the chemical name or the active ingredient, just as a way to recognize if you're taking an ARB or not. And some common types include candesartan or atacand. There's losartan or Cozar, olmesartan, Olmetec. Just some things to keep an eye out for. Okay, finally, we skipped one. There's a non-steroidal anti-inflammatory drugs. This is the N in SAD-MANS. So this is just a pain medication. So it works by inhibiting the activity of an enzyme called COX to provide pain relief. NSAID's the active ingredient in things like Aleve. Ibuprofen is another example of an NSAID. So why these might need to be stopped? Well, the first thing to do is just ask your pharmacist about over-the-counter medications and discuss stopping NSAIDs with your healthcare provider or pharmacist. Basically, they might need to be stopped because they can pose an increased risk of renal function decline when you're sick, so kidney function decline. Additionally, if you're sick and you're taking cold or flu medications, many of these also contain NSAIDs. So it's really important to speak to a pharmacist to ask what like the active ingredients in the medications you're taking for a cold or flu might be, so that you're not like double dosing on NSAIDs, you're not taking NSAIDs that you're not supposed to be taking. So aspirin kind of falls under this category. Low-dose aspirin is still recommended to be continued in short-term illness. If you have any major concerns, again, speak to your healthcare provider. And some examples of NSAIDs include aspirin or ASA. You have Celecoxib or Celebrex, your more common ones, so ibuprofen, which is Advil or Motrin, or naproxen, which is Aleve.
So these medications are important to understand. These medications, so aspirin is a life-saving medication. It lowers your risk if you're having a heart attack by about 40 to 50%. In people who have heart disease, it lowers your risk of having a heart attack by about 15%. But increases your risk of bleeds by 40 to 50%. So you have to balance that. All the other anti-inflammatory you see on these agents are bad for your kidneys, bad for your brain, bad for your heart. And so, but they're pain medications, so it's a trade-off. So if you have bad pain, you might not need to take some of these things, but you have to realize that they're bad for you. They're bad for your heart. They're bad for your kidneys. And so one of the things we think about is something called GFR, or your kidney function. So you should look at your lab results. And if you have a GFR less than 30%, none of these medications are safe and shouldn't be utilized, except for aspirin. And so really, decide if you need these pills. So for many people, I say, listen, my pain's so bad, I need to take, let's say, Celebrex or Aleve 2 times a week or 2 times a month. That's fine, but they're not health medications. So just always remember that. So, and if you get sick, you're dehydrated, they can actually poison your kidneys even further. So you can't take them during those episodes. Thanks for sharing that.
And finally, on to the S, which is SGLT2 inhibitors. So these inhibit the reabsorption of glucose in the kidneys, and we'll be going over this mechanism a little bit later. But that's how they work to reduce blood sugar. Essentially, you're peeing out sugar. So why they might need to be stopped? Well, you hold these medications off when you're sick to prevent a decline in renal function. A way to recognize them is they end with like eflosin. So again, looking at that chemical name can tell you if you're on an SGLT2 inhibitor. So some examples include Invokana, Forxiga, Jardiance, And so just some things to look for as SGLT2 inhibitors, while they're a very effective medication for diabetes, might also need to be stopped while you're sick. So a couple of points to consider. First, as I mentioned, you can find more information on Diabetes Canada. Combination medications were not included on this list or discussed on this list. So again, you can always check those out on Diabetes Canada, speak to your healthcare provider or your pharmacist about any combination medications you may be on, what the ingredients are, and whether or not you might need to stop them. If you do take insulin, you might have to increase or decrease your dose. Don't stop taking your insulin. Seek medical advice if you're thinking about stopping it while you're sick. But like Bo mentioned earlier, you might have to adjust the dose accordingly based on your symptoms and everything that's going on while you're sick. And please contact your healthcare provider if your blood glucose is higher than 14 millimoles per liter or lower than 4 millimoles per liter. You have a fever, you develop difficulty breathing, or you're unsure of what medications you're taking. And finally, a great recommendation is to create a sick day plan. So be a little bit proactive, have this discussion with your physician or other healthcare providers, other people involved in your care to make a plan for what you should do when you are sick. So ask your physician or pharmacist what medications you should temporarily stop when you're sick. And on the right, I have an image directly from Diabetes Canada. It's basically a little checklist you can make for yourself. So the medications I need to temporarily stop are, and then it has different criteria. So if you're eating less than normal, you might have to stop certain medications. So the ones that might put you at risk of hypoglycemia. When you're dehydrated, you might have to stop certain medications. So for example, like a diuretic might be something you need to stop if you're super dehydrated. And then this personalized list was reviewed last. So that just kind of makes sure that you're keeping on track and reviewing this list frequently so that you have the most up-to-date information and can be very proactive in your own care. Once you have recovered from your illness, you should resume taking your medications as directed. It's also recommended that you have a sick day kit, so supplies that you might need in order to help manage any episodes of illness. So a thermometer to check if you have fever, having sugar-free medications. So if you're sick and you're wanting to take like cough syrup and stuff like that, most of the stuff you find over the counter does have sugar in it. So you can speak with your pharmacist to be directed to some sugar-free options and keep that with you. And lastly, having important phone numbers at the ready in case you need to contact anyone to ask questions about your health or your medications.
So I'm going to just ask Bo here, a sick day plan. So when you're helping your clients or your patients develop a sick day plan, what sequence do you consider stopping medications? How do you approach that in type 2 diabetes?
So probably, Dr. Kernu, we would give the education, but the sick day plan would probably be that in terms of stopping medication, them actually calling us and us having a discussion with them about the specific situation at the time. What's going on with their blood sugar, what's going on with their hydration status, and so forth. I don't think we would just blanketly tell them. And the other thing to keep in mind is the medications are sort of a moving target. Things are changing. And so we tend to have them call us for the specifics around that. Education we provide on an ongoing basis, like Aditi has mentioned, but the specifics around how to manage medications with illness would be a phone call to us so that we can get more information about what needs to happen.
So the things I would be thinking about for when I'm sick, how sick I am. I like all the points that were mentioned, but the things you need to know is knowing your weight. Can you eat? Are you throwing up? What's your blood pressure? And so these are things that are important. So if your blood pressure is too low, you can't use blood pressure pills. If your blood sugar is too high, we got to do something about the blood sugar. And so to me, you can see that this is care is now becoming more virtual. So you're gonna have to learn too as well. So I want everybody to be part of the team. So when you call your healthcare provider, you need to have information available to them so they can help you. Fantastic. That was wonderful, Didi. Thank you. And thank you both.
Great. Okay, and so this is a good transition. And so Ginny and I will be talking about two specific medications that we might have just discussed. One of them being the SGLT2 inhibitors, and the other one being Ozempic. And so SGLT2, what does that kind of stand for? It stands for something known as the sodium glucose transport protein 2. So this is basically a specific protein that's found in our kidneys. And when we stop this protein from working, we are actually going to reduce glucose levels in our body. And we do this by basically increasing the amount of sugar that we pass in urine. So to understand the mechanism behind how this protein works and how this medication works, we first just need to look at what this protein actually does. So as the name kind of describes, it will basically transport two things, sodium and glucose. And it transports it out of the urine and puts it back in your bloodstream, because in a normal situation, glucose is valuable. It provides sugar, it provides energy for your body. And so your body wants to hold on to all of that sugar. And so in a normal situation, what you will actually be doing is you will be retaining and reabsorbing 100% of your sugar. But if we have too much sugar in our bodies, we don't really need to retain and reabsorb 100% of all the sugar that's in our urine. And so that's where these inhibitors, and that's where this drug comes in. And it will basically block that protein. And so you're going to pee out that excess glucose and you're going to pee out that excess sodium. And it's a very, very simple, it seems like a very simple concept. And so that's where we get this medication from. So this medication actually has a lot of different benefits. And if we go to the next slide, we can really focus on the renal and the glycemic benefits. And so these are the benefits for the kidney and for your sugar levels. What we noticed when we did studies and when we compiled all the different studies for the Invokana medication, for Zyga and for Jardiance, when we combined those, those trials, we noticed that just taking these SGLT2 inhibitors or taking these medications, you reduce the risk of kidney transplants, you reduce the risk of dialysis, and you reduce the risk of renal kidney disease and death by 30%. And so this was actually done by combining all the studies that were done on Invokana, on Zyga, and on Jardiance. And they looked at a total of nearly 40,000 participants. I think it was 38,700 participants. They saw that very, very few of them actually needed to actually had these complications, and it was a much reduced number compared to if you didn't go on these medications. And then with regards to your HbA1c values, and so when you go do a blood test, they look at your HbA1c values, which gives you a good indication of how your blood sugar levels have been over the last 3 months. And when they look at this value, after being on this medication, it's noticed that these values go down by 0.7 to 1 entire percent. And so this is that value you might hear, 6.5, you want to be below 6.5 or 6.0. This can really help you reduce some of that percentage value. And the way that what we've noticed with the studies, they looked at several studies combining 41,000 patients, and what they found was, on average, by peeing out those extra sugars, it's the equivalent of cutting almost 200 to 300 calories every single day. And by just compounding that, they found that over the course of half a year to a full year, you were able to lose 2 to 3 or 4, even 4 kilograms of weight. And if you remember last time, we talked about the importance of losing weight for diabetes remission, and how by losing, I think, over 15 kilos of weight, you would actually have the odds of 87 or 86% to put your diabetes into remission. And so you can see that just, this can really help, start, and then you can implement things like diet and exercise to once again lose that weight and put your diabetes into remission. And I'll pass it off to Ginny to talk about Ozempic.
Yep, so now I'll be talking about Ozempic, and the reason why it's continued in brackets is because we've talked about it in our last one, but I'll still be going over the general mechanism as well as a past study and an ongoing study. So semaglutide is also the same as Ozempic, so they're synonymous, and it essentially slows down food leaving your stomach. This is called gastric emptying, and so it helps to also reduce the amount of sugar released from your liver. And when your blood sugar is very high, then it increases the amount of insulin that's released from your pancreas. And actually, the reason why we mention it is because we're very interested in the weight loss component. It does help to reduce those blood glucose levels, but because it does help to suppress and reduce appetite, it's also been shown to help with weight reduction. Okay, so for this study here that we see on the slide, Ozempic, the 2.4 milligram dose, which is a high dose, showed to be a very promising treatment option for weight management in patients who were overweight or were obese with type 2 diabetes. So step 2 was a phase 3 randomized placebo-controlled trial, and it had around 1,200 adults with a BMI of at least 27. So this is taking into weight over height squared. And they had an HbA1c, which is your blood levels over the past 3 months. It was between 7 to 10%, so they were diagnosed with type 2 diabetes. And they were randomly assigned either the 2.4 milligram dose, the 1 milligram dose, or a placebo, which was injected once a week for 68 weeks. And they were checking to see if there would be a percentage change in the body weight. And they found that adults who were overweight and were obese with type 2 diabetes, that 1 week injection of Ozempic, that 2.4 milligram dose, was very helpful even with the lifestyle interventions as well. And it did lead to a great decrease in mean body weight when compared to that 1 milligram dose as well as the placebo.
So this is actually, if you go back to that slide there, or if you want to show us that the current dose of Ozempic that we use is 0.2, 0.5, and 1 milligram. So the 2.4 milligrams, once a week is not clinically available yet. But we share this because the results in weight reduction at that dose was incredible. And so I'm sure that's going to be a dose of the future. Right now, the doses we tend to use, I find 0.5 milligrams is once a week is a sweet spot for most people because the drug is expensive, about $250 a month, and at 0.5, or if you use 1 milligram, it could be also $250 a month. But there's a way of actually having the cost as well, and we can, and that's in the other video. So it's a phenomenally good drug, but it's also very, very expensive. And unfortunately, when you tend to stop the drug, the weight tends to come back. And it's also a phenomenally good drug of lowering blood sugar too as well. So it has advantages. And this is just the class. There's a couple other agents. The reason we picked Ozempic is this one is covered by the government at this point in time for so people at the age of 65 or people who have diabetes. The government will pay for this drug.
Mm-hmm. So the SELECT trial, it stands for semaglutide, which I said before is Ozempic. So semaglutide effects on cardiovascular outcomes in people with overweight or obesity. That's what the SELECT stands for. And this is actually an ongoing randomized control trial. It's including patients, around 17,500 patients who are 45 years old or older with a BMI greater than or equal to 27, so very similar to the last one, and who have established cardiovascular disease. So right now it's looking to see if Ozempic would reduce the risk of having cardiovascular events in patients who are overweight, who also had a prior cardiovascular disease. So the patients will be randomly assigned either Ozempic, which is a 2.5 milligram dose, or a placebo. And the study will last around 2.5 to 5 years. So the estimated completion time is around September 2023. So it's very similar in terms of the dose, the high dose of Ozempic, and they're looking to see if it'll actually reduce the risk of cardiovascular outcomes.
Ginny, do you remember what the actual weight reduction was in your with the 2.4 milligrams? What was the average?
It was actually, the primary outcome was greater than or equal to 5% decrease from baseline, from their original weight.
So the actual weight reduction was about 15 to 20% of body weight that took place at 2.5 2.4 milligrams a day. So that's not quite as good as bariatric surgery. Bariatric surgery is 20 to 30%, and this trial got to 15 to 20% in many people. So most diet and lifestyle changes, you get about 2 to 5%. You certainly do better, and with support, you can get 20% weight reduction. So this is actually this is weight reduction with good support as well as medications. So nothing replaces good hard work, and medications, it's like having, I know LeBron James on your basketball team, but having one superstar is not enough to win a championship. So this is certainly a championship drug. You have to pay well. It's an expensive drug. It works for many people, but it works only with lifestyle changes. And the dose that you're showing, Jenny, is a phenomenally higher dose, and it works. And then we'll see if this translates to reduction of heart attacks and strokes. Probably will, is my guess, but I don't know. And that's why we had to do good quality trials to know.
Yeah, that's a really good point. So emphasizing that, pairing this with lifestyle changes is obviously, you're going to get the optimized benefits for sure.
Okay, so now we're going to be talking about working together in a team. So today we'll overview 10 important people and the roles that they play in diabetes management. But just to overview, it'll be quite brief today. And if you wanted to have a more in-depth explanation as to why all of these people are important, you can also refer back to the article where we retrieved this information from. It's called everydayhealth.com, and there's added descriptions and statistics. So definitely check that out if you're interested in learning more. So the first person that we'll talk about as a part of managing your diabetes is your primary care physician. So this is the person you should see for regular checkups outside of the scope of your diabetes. This person is going to be the central coordinator of your care and will recommend you to certain specialists for specific issues. They will also follow up with you after you see a specialist and will help you to understand your treatment and care plan. They will also keep a complete list of your medications that you're taking. Next is an endocrinologist. So this doctor treats diabetes and diseases of the endocrine system, which I believe we overviewed last week. So some of the anatomy here includes the adrenal glands, the pancreas, the thyroid, and some areas located in and around the brain. The endocrinologist will also manage your blood sugar levels and make recommendations of medications. Next is the pharmacist. So this person is going to help you understand your medications, how they work, and explain any medication interactions if you're taking multiple. Next is a dietitian nutritionist. So this is a registered dietitian nutritionist, or RDN, who can help with weight loss goals, improving blood sugar, blood pressure, and cholesterol. They can also assist with creating diet plans. The fifth person is a dentist. Since a common complication of diabetes is gum disease, a dentist can be vital for diabetes patients. The sixth person is a podiatrist. So this is a practitioner who specializes in the lower legs and the feet and will carefully monitor you for any complications, which is definitely important given how much we know about the importance of diabetic foot care. Next is an ophthalmologist, which is an eye specialist who will monitor and maintain healthy vision, since eye complications can arise from uncontrolled blood sugar levels, including a diabetic retinopathy, diabetic macular edema, cataracts, and glaucoma. Okay, next is a certified diabetes care and education specialist, or a CDCES. And they're going to help you develop a diabetes management plan and put the lifestyle changes into practice. Many of these professionals are also RDNs, which we discussed earlier, so registered dietitian nutritionist, which means that they can work closely with you to develop healthy eating habits. Okay, next, and another important aspect of your diabetes management is going to be your inner circle. So definitely having your loved ones by your side is important for providing positive support and managing the stress associated with diabetes.
Check the joke.
And then finally, we have support groups, which they can connect you with fellow diabetics who share the challenges you have and offer tips for a healthier lifestyle. There are also really great resources on Dr. Kearney's YouTube channel. We overviewed last week how you can get there. So just a quick Google search of Dr. Kurnu's name. And if you scroll down to this video over here, the team was joined by a local pharmacist in the Hamilton community who actually works at the Cannon Street Shoppers Pharmacy. And in this YouTube video, they outline the services offered at Shoppers, such as the A1C, vaccines, medication renewals, drug consultations, and many more important topics. They also discuss topics such as renewing prescriptions, the use of blister packs, questions you should be asking your pharmacist, drug interactions, and the differences between generic versus brand name medications. So the goal of this webinar is to help you understand the role of your pharmacist, as well as how you can rely on them to help manage your health. So if you're interested in learning more, definitely head to Dr. Kurnu's YouTube.
Okay, so Jessica, you mentioned the inner circle, and there's obviously a lot of different people involved in the healthcare team, but this is just a few examples of how to get your friends and family involved in your healthcare, and also with helping with their healthcare. It's always great to feel like you're working together as a team, especially with friends and family who you feel like pretty comfortable with. I think it fosters like a really great spirit of collaboration. It keeps you accountable for one. And so these are just a few examples that I'll go over. One is making a new healthy recipe and sharing it with your friends and family, and maybe exchanging one with one another. Perhaps you can get like an upgraded version of one of their favorite meals. If you really like mac and cheese, which isn't the healthiest for you, then I just listed an example here, and it's an alternative mac and cheese recipe that uses chickpea noodles. You can also swap out one ingredient for a new one. So spaghetti squash has been like a pretty well-known trend recently. It's a fun swap for pasta. It's a lot healthier, which I've put in the middle there. And then on the bottom right corner, you'll see if you're craving an ice cream or a dessert, you can try banana ice cream, which gives the same soft texture. In addition to just healthier diets, try to get active with your friends and family. So maybe starting like a challenge together, initiating like a family walk around the neighborhood, or maybe a game of tag with your kids or your grandkids. And instead of meeting up with friends or family for meals or coffee, try meeting up for a walk and maybe having a chat there, especially with the COVID pandemic going on, making sure that you're obviously social distancing or going with people who maybe you live with. And then another last thing I wanted to mention was maybe inviting them to a workout class. There's a lot of online classes happening right now, or maybe calling to tune in together. And, this can be very intimidating or scary for some people, but just be mindful of what classes you're taking, some instructors that you can be introduced to. There's a lot of beginner or intro classes that I think are great with just introducing you to basic movements that are broken down to more simpler terms for you to understand.
I'm just going to give a plug to the people like Jenny and her team, because Jenny and her team are calling people up and just trying to help gear the right direction. We all need support. If we're all perfect, we wouldn't need each other. And so I appreciate all that she's done and the rest of the team here as well. Also that you mentioned about different recipes. Aditi does these wonderful, once a month we do a couple hours of cooking. And last month or last Sunday, we cooked, and there's some really great cooks on there, and there's some bad cooks like myself. I didn't burn the oven this time, so that's good. We actually cooked in some healthy desserts and stuff like that. Zoe and others have really put together a bunch of good sessions on different diets, from plant-based eating to Mediterranean diets to DASH diet. You can take a look at that, and as people have contributed. Starting at 7 on Wednesdays, we have the 3 M's, motivation, mindfulness, and movement. And so we always start off with a good meditation session, bad jokes, and we do some workouts if we want to, and good discussions on motivation. On Tuesdays, we've got Mira and Devanshi that have a 75 people group about weight reduction. So we have over 200 videos that's led by Stuart right now, that who really works hard at putting together a repertoire of really health information. So it's you have to make the first step. We'll help you with it, but you know what? Hard work leads to good outcome right now. And so I'll just say one thing is that people are worried about the AstraZeneca vaccine right now. Let me put this in perspective, is that a lot of women take the birth control pill, and basically the birth control pill is 200 times the risk of causing a clot compared to the AstraZeneca vaccine. So So, all the vaccines currently available decrease hospitalization and deaths from COVID by 90%. So let's use proper science, put things into perspective. Governments promise everybody an ICU bed, adequate resources, they're not. So keep yourself healthy and make yourself healthy so you don't get COVID. And if you do, make sure you're vaccinated. Is my plea to you. Any vaccine's great. And I'm going to make some good mac and cheese one of these days when my daughter gets back from out west one day. But I really thank Ginny and Bo and everybody else out there on that team who's done so much to make you healthier. You guys made me healthier, and hope we can all make each other healthier as well as feeling more safe. Thank you, Ginny. Go ahead.
Yep, thank you, Dr. Kerner, for these wonderful words. But just to sort of finish off with some of the things you should bring to your appointment for us to better serve you and just to sort of keep in mind. So on the first slide, first things first is health card. If it's outdated, I'm not really sure what the current thing is, if you have to, if it's expired and you have to renew it. But just, keep in mind that health cards are really important for us and your healthcare team. Things such as the OLIS search, which is the Ontario Laboratories Information System. It allows us to access your lab records and other medical records that are important for us to serve you, such as hospitalizations, as well as your physician team. Sometimes, your family, your primary physician changes, and it's important for us to know, who to correspond with and who's taking care of your diabetes and other things. Pharmacy, if your pharmacy changes, we should, just let us know so that when we fax the information, it doesn't go to the wrong pharmacy, and for you to be able to access them, as well as any healthcare proxy. If you have a family member that you'd like us to get in contact with because of your, language barrier or you're hard of hearing or just in general, just let us know about that, because that's kind of important for us to know. And then on the next slide. And these are some other key information to bring ahead of time. Again, medications list. So just being proactive about it. I know Dr. Kearney likes to use, the fuel in the car. Just why wait until you're all done and then refill? Just sort of being proactive and conscious of these things, because they really do matter. Just a statistic for you here. So according to the Canadian Patient Safety Institute, around 28,000 deaths occur due to medication errors. So it's really important to have an updated medications list, and if things change. Blood pressure, blood sugar log, and BMI, each 10 millimeter per mercury drop in systolic pressure, which is the top number, can lead to significant risk reduction of heart disease. So it's important to keep your blood pressure. And, sometimes I ask patients and they tell me, oh, blood pressure is normal. Well, blood pressure really fluctuates. And so again, that's why it's important to keep a log. Blood sugar, we talked about this earlier, you want to stay around 4 to 10 after 2 hours of a meal. And so just also keeping a log is just important to see how it fluctuates throughout the day. And then BMI, ideally you want to be between 20 to 25 because it reduces risk of hospitalization due to COVID. And for type 2 diabetes, we talked about it last time, type 2 diabetes does increase greatly with BMI over 25. Blood work, again, Dr. Kuno or any other physician will probably tell you the frequency they want it at, but that's also important, to get blood work done, and hospitalizations as well. I'll open up here to Dr. Kerner or Bo if they want to jump in.
Bo, do you have any words of wisdom?
No, I think this is great, and I think oftentimes we do get more out of the appointment. We're able to help people more if they come prepared. I think the other thing I would add is to bring some questions too. Questions that you might have that you want to talk to your healthcare provider about.
Also open up to anybody from the teams or people out there with some of the questions they have. So one of the things I find ironic, if you change your phone number, you change your address, how do I know? You gotta let your people know. And I think is that for healthcare providers to help you, you need to be part of the team. And if your best way to get a hold of you is your cell phone, then make sure people know that. And if you moved or whatever, that's fine too. Let us know too as well. Is that there's more and more things happening with this virtual world, and you have to if you say, listen, I had this test done at the Hamilton General Hospital, nuclear medicine study done 6 weeks ago, where I was hospitalized 2 months ago. Nobody knows necessarily. You have to tell people, and then we can actually, that Adam was showing, is that we have the ability now to go search hospital records, but it's like looking through a phone book. You have to direct what part of the phone book we need to go looking for to find that information. Not everything's available, not everything works. You can see right now that getting a vaccine in Ontario or in Canada is a nightmare. There's so many different systems. There is not one common system. So there's multiple lists. So you need to help make your list so we can actually answer your questions and also search the right places when it's possible. We don't have free access to all your information. We have limited access to certain things. And I really love what everybody's done here today, is trying to make you involved in your health. That was great. Any other thoughts from anybody else at all when we're making phone calls and things? Is that one of the things that's always is that, well, I didn't measure my blood pressure, I'm going to measure it now. No, it's not the time to measure your blood pressure when you're talking to a doctor, to a nurse, whatever. It's going to be artificially elevated. And you're also taking valuable time away from your visit. You want to spend time learning and things of that nature, not measuring during that time. So, and if you have trouble measuring, we'll teach you. That's wonderful. Thanks. Any other thoughts by anybody else?
Okay, so any questions that you have, feel free to reach out to our clinic, or you can put it down in the chat function below. But otherwise, thank you for listening. I think we've tentatively set another date. It's not set in stone yet, but we plan to meet the third week of June, I believe. But we'll make sure to keep you updated about that. So that would be June the 16th at around 6 p.m. So the same day of the week, same time. And I just want to thank you all for, calling in, and for those listening in. I want to thank you for, trying to work on your health, actually working on it throughout this pandemic. At first can be really hard, but making sure that you find a team who, is supportive and is keeping you accountable for these sort of things.
I just want to thank everybody for their hard work during this pandemic. One of the things, the forgotten thing about this pandemic is that many of us have forgotten the preventive aspects of things. And I think we're getting back right now. Now that the weather is better, I'm encouraging people to get outside as much as they can, provided it's safe to be outside. And I think in many circumstances, it is safe. And so just do that wisely. I want to thank Ginny and everybody else on their team, as that I think we've been blessed with about 100 people that have helped us make you healthier. And I want to thank you all for your active participation. But also is that this is a time for action. This is time to become healthier. And now we can actually use better technology. I'm learning. We're going to make lots of mistakes, but we'll have fun learning. So if you're not making mistakes, then you're not learning. And if you're not participating, you're not going to get healthier. And so this is a great time right now. We have so many new therapies and so many new aspects of things. Any thoughts from anybody else at all? And if you ever want to get hold of us, you can call us at the clinic. And of course, the clinic phone number is 905-667-0783. The fax number is 667-0785. You have drkernew at 232gmail.com is our email to goes to the front desk, and any questions or thoughts that you need, please send it to there. I just want to thank everybody for a great day. I'm looking forward to everybody being vaccinated as quickly as we possibly can. The vaccines have outperformed expectation. I wish there was a vaccine for diabetes, but as I heard earlier today, the best vaccine we have for diabetes right now, if you're overweight, is to lose 20 to 30 pounds. You can put your diabetes into remission if you've had it for 5 years or less, if you have type 2 diabetes. That's phenomenal. And the team's explained that feet, eyes, mental, physical, all important. And thank you all for taking care of yourselves.
I want to quickly thank Dr. Kernew, my entire team for helping me out this year, as well as Bo. Thank you so much for joining in our meetings and contributing your knowledge. I'll go ahead and, thank you all for listening in as well. I'll go ahead and end the meeting here. Thank you all.
Good night, everyone.